started to have this practice in a very properly manner, but still I think we need to have a lot of awareness on how one should evident the care, intervention, and the process and the documentation. That is how we have chosen this topic today. Me, the Shanti Bhattacharya, today the Vice President Nursing, I'm here in front of you to present the topic, but actually this topic is supposed to be presented by one of my nurse manager who is from Nigeria, none but Miss Sabina, but I think past 15 minutes we were trying to connect and there is a lot of heaps of network issues which is intermittently, it is disturbing us. So I think this is the time I have taken up the session and I will be presenting hereafter. Just a second, slide. So as the German philosopher Mr. Socrates says, to believe without evidence and demonstration is an act of ignorance and no sense of humor. As you know, if at all we do any intervention, we should always have the evidence for the same. So if you don't do, it means we are not playing our part with the common sense of humor. So here, what is evidence in general? Something which is requiring the proof, which is requiring somebody's testimony, which is requiring one whose witness is required. And evidence in medicine is nothing but a scientific evidence. Let's say a nurse operates on the ventilator or handles the ventilator. She would always set the ventilator setting and then only she will set the patient on the ventilator mode. So that is how we all nurses, we work with the scientific, rational evidence and then documentation. So for example, patient who is unresponsive requiring chest compression, which is nothing but CPR. Now, when we talk about the key components in evidence-based practice, I request all the viewers, maybe, sorry to say, maybe you can view Miss Sabina also, or we may get in between the connectivity, so we can put Sabina into the platform. Until then, I'm just going to talk about the EBP. Now, we have three components, which is nothing but clinical expertise, patient preferences, evidences. Where the patient preferences are, if at all patient wants to have the nutrition or patient wants to have the diet, here the clinical expertise is a nutrition plan and evidence would be the nutritional plan which is given by the nutrition. So these components which we practice in nursing. What is evidence-based practice in nursing? The term evidence-based is often used to describe a practice or treatment which is based on scientific evidence. For example, education tools like webinar. Now, what webinar I am presenting to you is a scientific rational because we need to create a awareness for the nurses. So we have used something called tool like social media connect or webinar is our platform. Medication administration. Now, a nurse gives the medications with all the scientific rational. So do the act and process of administration of the medications. Assessing the patient for pressure. So we do have a Braden scale assessment and lot of nursing pathways for which we assess the patient. We assess subjectively, objectively, and we do document. That is nothing but with scientific rational. You think we nurses need to have EBP in practice? Yes, of course. When the accreditation law and government of India and national, international wants all the evidences. Maybe you provide the diet to the patient, the evidences should be there. You provide the medication to the patients, the evidences should be there. So do the intervention and documentation. Let's see what it does to the nursing practice. It improves nurses' decision-making process by bedside. Yes, if at all nurses need to change the position, they need to see the nursing pathway that why we need to change the position. Maybe there is a poor risk of nutrition intake. Patient is very fragile. Patient age is not appropriate. Patient has got a lot of comorbidity. That is how nurses bedside will take the decision by turning the patient every second hourly with scientific rational is nothing but your evidence. Provides more individualized patient care. If we choose this EBP components, then our care is not deteriorated or deviated we are towards the patient-centric goal. It provides a better understanding of the risk behind certain treatments and informed consent from the patients and family members. Let's say if a patient requires mechanical thromboprophylaxis or DVT prophylaxis, it has a rationale that otherwise patient may contract DVT, for which we again talk to the patient attender, we give the informed consent, obtain the good consent, and that's how we participate in care regime. It boosts the efficiency of patient recovery. Obviously, when you are very transparent in your daily to daily practice of nursing, I'm sure that patient recovery and patient also will like to have the care which is provided by you all. It can empower nurses. As I said, if nurses are given the nurses pathway, I think it will not be creating any kind of confusion. It can empower nurses. Nurses will be very happy to work with other clinicians and establish a very effective treatment for patient safety than providing care without rationale. Rationale is nothing but without any appropriate time you check the vitals, without any appropriate time you maybe switching on to one care to another care. It should not go like that. That is how we have a lot of evidence-based nursing processes in place. Now, when I talk about cornerstone, which is very vital in nursing process, first, what do we do when a patient comes to the hospital? I always assess the patient. I want to just as a nurse see whether what is the problem with the patient. Identify the problem, which is nothing but we do assessment and diagnosis. Second is assess the patient evidence. What is patient has come with the problem? Maybe patient has come with a lower leg cellulitis, and for which what is my plan of care? After that, what is my appraise on the evidence? What do I plan? What is my plan which is onto the implementation? That's again, I appraise the evidence. After that, I apply evidence based wherever it is applicable, like implementation. Maybe doctor has written the max self dressing or the aseptic dressing to be, provided to the patient. So what is my evidence on the same? I go through the doctor's order. I do collect all my nursing articles for the dressing, and then I implement the care. After that, I reassess, I document, and I evaluate the change. Unless having the evaluation, we cannot drive the outcome of any patient subject. So that is how the cornerstone, I think this is nothing but your nursing care plan. And all the nurses, I request that we should stick on this plan of care, which will drive you to the scientific rationale. Now, let us see the robust example. Like how I said, this assessment, diagnosis, and implementation is always important. Like, for example, you elevate the patient bed between 40 to 45 degrees to prevent the risk of aspiration and ventilator-associated pneumonia. Maybe 20 decade back, we didn't know why do we elevate the patient's bed. Maybe doctor has said, maybe I feel the patient is not able to eat, but you see the associated risk which patient may have. Nothing but ventilator-associated pneumonia can happen, or patient may have the pool of secretion and patient may have positional pneumonia. Scientific rationale is critical thinking and applied the evidence to patient care. That's how the technology also are responsible in applying the evidence of patient care. Second, what do? You have evaluated the effectiveness of the plan. When you do this Fowler's position and you do the raise of the bed, your VAP, your positional pneumonia, your aspiration pneumonias are zero rate. What is your evaluation tools again? Monitoring the effectiveness of the plan, which will determine whether patient is improving or not day by day. So again, robust example, you see what do we do before administering the medications to the patient? We do assess. We do see the doctor's order. We do see what medications are being given. Maybe pharmacist or nurse, they do the indent. And after that, we also check the vitals of the patient. Let's say if I want to take the beta blockers, or before providing the beta blockers to the patient, I need to always check the patient vitals, whether my patient's pulse and blood pressure is okay before medication is given. Also monitor vitals during the beta blocker infusions or post also. So scientific rationale is nothing but the patient priority, patient safety is not to be compromised here. Post, pre, and intravitals are very important. When you always golden rule is when you administer the high-risk drugs. Again, the example is patient education on the acquired hospital fall prevention. Any patient who comes to your hospital, it is not that patient will not be prone for patient fall, always. And when the patient is vulnerable in nature. So what do? You take your nursing pathways in terms of your nursing fall risk assessment. You talk to the patient, whether patient has a previous history of fall, etc. You have a fall prevention checklist. You do have a nutritional assessment checklist. Otherwise, we just cannot provide the diet unless we have calculated the nutritional intake as per the patient comorbid status or patient diagnosis. You have infection control education checklist and tool where you are not only to the healthcare providers, you also demonstrate to the patient and attenders that what aseptic minimal barrier to be taken when they enter in the ICU or in the ward, and they closely move with the patients. So the review of literature, actually this is supposed to be presented by Sabina, but here one of the hospital where they've seen the knowledge and utilization, as I was telling, evidence-based practice nursing is in boom, but not many of the nurses and the clinicals in the clinical scenario, they don't practice because of no awareness, or maybe they do not really understand the concept. Having all the tools in the place, still we do not know how to practice, what to write, where to document, and what is the quality assurance parameters we need to drive out of this review of literature. So when they have assessed, they have seen the descriptive study about 110 questionnaires they were administered to the nurses, which was their inclusion criteria. Findings were revealed that there was there was no knowledge and utilization which was matched towards this evidence-based nursing practice. Also, there is no significant relationship between professional qualification. Let's say a nurse may be a graduate, but she doesn't know what is EBP, or maybe she's doing the vital check, or maybe arterial mean pressure of the ventilator patients, but she doesn't know what is a scientific rationale and what to document, what alarm she need to give to the doctor. So that's how the recommendations, what was given in one of the Nigeria hospital was that they had created more of awareness so that the unfilled gaps which was created, maybe they may be able to fill in the long go. So, and after that, the conclusion was, the management, the clinical, the doctors, and the administrators would always develop some protocol so that nurses can fill the gap between this knowledge and utilization and good practice on the EBP. Now, we do, anytime anything you start, there will be always seen or noted advantages or disadvantages. So let's say what advantages we have in EBP is nothing but the foremost advantages, I should say, that it will always improve patient outcomes through superior care. See, when we are transparent, we show everything. The dichotomy of the nursing practices are spoken. Why are you being shifted to the OT? How long it will take? When you will be coming back? What time you will be able to take your oral diet? If these scientific rationales are spoken timely to the patient, I don't think that patient will always nag, or the attendant will always ask you. So that the communication also plays a very vital role. This nothing but it will always give you a very good patient care. Nothing. Second advantages is maximizes providers' time and reduces cost. Obviously, as I said, when you want to select any technology for the patient, when you speak about the benefit out of the technology, if let's say this sleeve garment, lower limb garment, which will refrain your DVT, your calf compression, your lower leg will be compressing very properly and you will not have DVT. So I don't think that patient will have any challenges, but it should be timely and cost everything to be explained to the patient as well. Third is adds new contribution to the science of nursing. As I have already told, if EBP with the rational when you speak, maybe a term of process, technology, care, on the clinical practices, case scenario, or any disease condition, when you talk, you always contribute in science of nursing as well. Let us see what would be the disadvantages of EBP. Family members may not be comfortable. Yes, if you give one device to the patient and you say, maybe it is a spirometry, they may always ask you, different, the cost is different outside. Why this is here? Why this has got this features? Why I cannot have these features of something from some different company? So family members may not be comfortable, but I always believe if we, align with them right from the day one and we talk to them, timely information we provide, I don't think there will be any hazels in that. Fear of litigation, yes. Anytime we provide evidence or maybe documentation, or they want to see our documentation, we might have a little litigation issue, but we can always involve our senior ups for the same. Patient privacy may be compromised, yes. Patient privacy may be compromised, but if it is dealt in a proper way, I don't think it will be an issue. Additional stress for healthcare professional, yes. That is how we urge and we request all the nurses and doctors, whatever we do, we always have a mode of audio video counseling. We always tell the patient and patient attenders, look, you have come in this stage, now you're progressing towards this second day or third day, and your outcome definitely are going to meet, or so do the patient bad outcome as well. In short, evidence-based practice in nursing is now widely recognized because whatever you want to talk, you speak about proof evidence. Maybe you have given the medication to the patient, but patient attenders or patient wants to see what is a vial look like, how much you have withdrawn, how much has been given, how much is diluted. And I believe me, that is their right as well. So consolability, if at all we talk, these timely process and interactions with the patient and attender, I don't think there will be any problem. Practice all the developed accredited clinical nursing tools and improve upon patient safety and gain self-knowledge. That is how accreditation laws and hospital policy and governance policy says. Whatever you practice, you follow the guidelines, document, and keep your patient and attender in loop. So by saying so, if you look at this monkey is nicely listening to the heart sounds. As you know, monkey cannot listen to the heart sounds, where we have got 4 to 5 different normal and abnormal lung sounds, but pretending as if I know and we all know. So I urge all the nurses to practice evidence-based nursing practice. At the same time, I would like to give the message from Sabina. Sabina, do you have the connectivity right now? Can you talk?
Can you hear me?
Can you
hear me?
Yes, I can hear you.
Okay.
Can you provide the message to the Indian nurses, like why they should practice this evidence-based practice? If you cannot, then I will be taking the loop from now, because I think there's an internet network issue.
There are so many reasons why nurses should practice evidence-based nursing. First is for efficiency. It increases the efficiency of nurses, making the decisions based on knowledge. And this is backed by research, which makes it easier for a nurse to choose what care to provide to our patient as opposed to trial and error. Okay? When you practice, you improve your efficiency, and this efficiency is backed by research and knowledge. Okay? So you don't do trial and error.
So one thing I would like to ask you, so in your country, yes, you're from Nigeria, it is a state, it's a country of dense rainforest, multiple ethnic cultural diversity. I appreciate that today, because due to the connectivity error also, you are still patiently waiting for this platform. What do you think in your country? Do you practice all nursing pathways in terms of surgical safety guideline, in terms of IPSG goals, in terms of nursing assessment for the patient, in terms of nutritional assessment? We have fewer minutes where we can discuss and wind up. Yes.
Yeah, in my country, we may be limited by equipment and facility, but to the best of our knowledge, the nurses carry out evidence-based practice.
Yes.
Okay, based on research, and they carry out their assessment properly.
Okay, so would you recommend this EBP to be practiced in daily life scenario where nurses, the advocacy of the nurses will be safe?
Definitely. I encourage more and more nurses to adopt evidence-based practice in their terms of in carrying out their career on a daily basis. And I also recommend that we create more awareness amongst our nurses. And according to the earlier research that you cited in the review of literature, you will discover that the level of awareness on evidence-based practice here in Nigeria is very high.
Very high,
the utilization is low.
Yes.
Okay. So we have to create more awareness on utilization. It's not as if the nurses don't have the knowledge, they have the knowledge, but they are not practicing it in every day-to-day activity. And I also mentioned one of the reasons might be as a result of the limitation in terms of infrastructure and in terms of the facility that is available.
Yes. So at last, I think we are just nearing wind out. Would you like to give a certain any kind of message from your end, since we are just thankful to you that you have come to this platform today? Would you want to give a vote of message to the nurses or to the?
First of all, let me apologize for the network over here, which was really terrible.
Still fine, no problem.
To be able to link. But I want to thank Dr. Pavan for the opportunity he has given me to be a part of this platform. And in a special way, I want to thank you, Nurse Shanti, the VP, Nursing Services in High Tech City. You've been a very good role model. You've been very, very of great assistance in preparing for this presentation. So thank you so much. And let me add, you're a very good teacher.
Thank you.
You are a very wonderful teacher. And my love to all nurses there in Hyderabad.
Thank you so much. And we will surely connect again. And sorry that we couldn't take you also. And these are the natural connectivity error. Nobody can do anything. And having said so, thank you so much. All the Indian nurses also are very thankful to you that you have given your very precious time for this platform. And having said so, I urge all the nurses, please keep trying. Very good guidelines are there in all the hospitals, especially in Yashoda Hospitals. Keep practicing those intervention of care, your process, your scopes of services, keep documenting, connect with the patient, communicate. I don't think there will be any error. Stay tuned again for the coming Thursday. We will again connect. Thank you so much and have a safe stay. Thank you.